The Intern Survival Guide, facilitating the transition to residency.
The Intern Survival Guide, henceforth referred to as the ISG, started as an online compilation of specific details regarding information for rotations in the first year of residency in family medicine at Samaritan. This information included items such as rotation expectations, dress code, important locations, and navigation of the electronic medical record. The goal of sharing this information was to increase resident preparedness and facilitate the transition from medical school to residency. This was formally introduced to the family medicine intern class in the summer of 2019 in the form of a pocket-sized booklet specifically designed to fit into the pocket of a white coat for use during the 2019 to 2020 academic year. The version evaluated in this project is the second edition of the printed ISG that was distributed to the intern class for the 2020 to 2021 academic year.
Utilizing data from the first edition, the ISG was reviewed and updated with the goal of improving first-year resident feelings of overall preparedness. Additionally, the authors felt certain details were missing from the first edition, including information regarding the paging system, navigating to the on-call provider list, and understanding admissions and discharges with respect to all inpatient services. These concerns were addressed by adding content, rearranging information, and including a table of contents.
On presentation to the intern class, a pre-survey was distributed to assess perceived preparedness before exposure to the ISG. The ISG was then presented and reviewed with the class. Near the end of the academic year, the same survey was re-administered to assess the impact on resident preparedness after having utilized the ISG.
The results showed the majority of residents utilized the ISG throughout the year in addition to their seniors. There was statistically significant improvement in preparedness after utilizing the ISG for rotations in inpatient medicine, cardiology, inpatient pediatrics at Good Samaritan, inpatient pediatrics at Randall Children's Hospital, and outpatient pediatrics. There were varying levels of preparedness reported for rotations in general surgery, OB-GYN, and emergency medicine despite using the ISG. While the percentage of interns who felt they could easily always find information about upcoming rotations doubled from the previous year, this was found to be statistically insignificant. Overall, the intern class reported increased preparedness and high utilization of the second edition of the ISG.
With respect to future versions of the ISG, there are several areas for further investigation. Additional attention to the general surgery, OB-GYN, and emergency medicine sections could identify specific difficulties that were inadequately addressed. While information concerning wellness and resources were added to the ISG, they were not explicitly evaluated on the provided survey. It should be noted that COVID-related updates were not well established at the time of the creation of the second edition of the ISG. Therefore, it is unclear how this impacted the utility of the guide.
Thank you for listening.